Hi Dr.Jha, I hear you've been doing the treatment here for PPP at Renew Skin and Health Clinic in Leamington Spa for quite some time. What is PPP?
PPP is also called as Pearly Penile Papules, and we have been doing Pearly Penile Papule treatment in our clinic for quite some time now, especially those boys who are quite concerned. We generally discourage them to have this treatment, and there are certain reasons for that. But yet there are clients who just want to get rid of this. They hate this appearance of their penis because now what is PPP? These are natural occurring lumps in about 25% of the boys. If you have 100 boys, 25% of the boys will have pearly penile papules. In some there will be less, in others there will be more. And they occur around the coronal sulcus, which is the neck of the penis, or on the ridge of the head of the penis they occur, and they're unsightly, they look ugly, but these are natural variation that you see in many boys' willy.
And how does it affect the people who get them?
Well, it can affect them psychologically because the psychological impact these PPT does is a lot that what you can expect. Or you can imagine really, because they think that they have contracted some sort of disease with some sexual activities, and they think that it is genital warts, they think it is HIV, they think that it could be anything, and that's why they're concerned about this.
But they're not sexually transmitted?
They are definitely not sexually transmitted, they are normal variation of the penis.
Right, right. Does it have to, do they have to be treated or removed, or can they leave them?
Well, as I said, that they are normal and they can very well be left unless the patient is really concerned and they got some sort of psychological imbalance because of these. And they hate these lesions because they think it is sexually transmitted, or there are genital warts, or they're having relationship difficulty. They found a new girlfriend and the girlfriend thinks, oh, something abnormal, and the boy is obviously keep losing the girlfriends, and they're concerned, they want to get rid of these.
So anybody watching this might be wondering how they can be removed?
Sure. Well, they can be removed by ablative treatment, and there are various ablative treatment available across the globe. And one of them is CO2 laser or RBM laser, or even radiosurgery that we do here in our clinic. And they're quite, all of them are quite effective treatment, but they all have some amount of complications. And because they're natural, natural variation in the penis, how it looks, I particularly discourage them to have treatment. But yes, if they are quite concerned and if there's a anxiety associated with this, then yes, they can have the treatment.
So if they wanted to go ahead, which one would you recommend? Which way to get them treated?
Well, they can have it removed either by the laser, which is CO2, or other ablative laser such as RBM. And the laser is an expensive treatment. A little cheaper option to go for it, and possibly safer, is radiosurgery or radiofrequency surgery, where we apply the numbing cream for 45 minutes. After that, the penis is numb, where we are going to treat it, and then we remove them. The procedure takes about 20-25 minutes.
And would they be gone forever?
They will definitely be gone forever once they are treated. Obviously, you have to understand these lumps are most visible in the erect penis rather than flaccid normal penis. And yet there is a possibility that 1 or 2 lumps may be left after the treatment. But we tell them that if they notice any lump after the treatment is done, say 3 weeks later, then they can always come back and we'll do that free of charge.
That's good, okay. And what is the recovery time?
The recovery time, generally speaking, 2 weeks. We ask them to leave the penis alone, to not have any penetrative sex during that time, and after 2 to 3 weeks they are fit to go back to their normal activities.
So Dr.Jha, can you tell us what the complications associated with their removal would be?
A good question, because there are so many complications can happen following any surgical intervention, and the radiosurgery that we do is also not free from any complications. They also have complications, but the complications are rare, and the common complications are wound infection. So following the procedure, 3 to 5 days later, they come with some discharge, smelly discharge maybe, and these are infections, and they can clear with oral antibiotics for a week. Other complications, delayed wound healing, the wound takes longer time to heal. Yet another complication is forming of adhesion, and temporary as well as permanent numbness around the treated area is also a possibility, and they should consider all these things before they sign the consent form.
Yeah. So they need to think about those possibilities.
Sure.
And is the treatment available within the NHS?
Well, I doubt if it is available through the NHS, but yes, certainly these boys can go to the GP and ask them if they can be referred and treated in the NHS, but I'm not aware if this is available through the NHS.
And finally, is this treatment available across the UK?
Well, through our clinic, we have some satellite centres across the country. We are doing in Leamington Spa for quite some time now, and we've also started up some satellite centres in Nottingham and in up north in Leeds and Sheffield, and also Manchester, Liverpool. We're considering to open one other branch in London as well as Cardiff.
Okay.
So we have quite a few centres to cover the whole country really.
Right, that's very good. Okay, thank you for your time, Dr. Jha.
Thank you.